My name is Dr. Edekpolo Osazoa, consultant obstetrician and gynecology at Grachelle Hospital. We continue our series on our lectures, which we've done earlier. We talk about reasons why people will do an assisted conception. But today we'll be talking about the test that a man needs to do before he proceeds for an assisted conception, or a test a man needs to do before he says I do, or when he wants to get married. Now, this we refer to as male investigations. Now, they include, for a male that is going through, that want to participate in IVF, or for a man that want to get married, these following things are very important. One, we will try as much as possible to do what we call a detailed history for the patient. Secondly, we'll do a detailed physical examination. And lastly, we'll try to do what we call seminal analysis, as well as hormone profile. The reason why we do this, we take history from a patient, why we do physical examination, why we do seminal analysis. This will help us to identify any pathology or any cause of male factor infertility that can be corrected or that can be enhanced. Because there are some causes of male factor infertility that we can always correct and that we can always make better. Now, history taking, what are the things that we ask? What are the things that we ask patients when they come for fertility screening, or a man that want to get married? One, we want to check, ask if when he was giving birth to, whether he have any form of abnormality. Probably we have asked his parents. What are those abnormalities? There's what we call undistended testes, which is called cryptorchidism. Secondly, we want to find out when this patient or when this man attain puberty. This in our mind. We want to also find out whether this patient has had any form of surgery before. For instance, anorrhea, especially when the child was young, because this can result in inadvertent damage of the vast difference that was not recognized. We want to find out whether the patient has any history of MOS before, which refers to as mom orchitis, especially when the patient was in a very young age. Sexually transmitted infections are also be known. So we want to find out whether the patient has been treated for any form of sexually transmitted disease before. We know that whether the patient has had any form of surgeries. For instance, instrumentation or trauma has happened to any of his genital urinary tract. Sexual dysfunction is very important, such as erectile dysfunction, ejaculatory dysfunction. These are key things that we normally ask when a patient comes for evaluation. If we establish that any of these things are there, we'll quickly correct it and act accordingly. My name is Dr. Edekpolo Osazoa, consultant obstetrician and gynecology, the only doctor of hope. Don't forget, as a man, you need physical examination, you need a very good history, and we need to examine, do a sperm analysis, which we know as SFA or semen analysis. Thank you very much for listening.